This is Brandy Shantz, and you're listening to Living Chronic. Today, I want to start by talking about IBD Awareness Week. Today is the first day of IBD Awareness Week, so it's a great time to talk about the disease that I've been living with for over a decade, Crohn's, and of course, ulcerative colitis. Largely, these are invisible diseases, as we like to say. People tell me all the time, but I don't look sick. You don't look sick, but we are sick. And this is a great week to learn a little bit more about what it means to have IBD, what it means to be a caregiver for somebody with IBD, what it means to be a supportive friend to somebody with IBD, and just to learn a little bit more about the diseases themselves. Today, I really want to focus on biologics. So, biologics, in particular, TNF inhibitors. So, what is a TNF inhibitor? So, tumor necrosis factor is what TNF is, and it's what causes inflammation. In a healthy person, your body and blood just naturally eliminates this. But in those of us with autoimmune disease, certain autoimmune diseases, our body doesn't do that. So we take a biologic that is a TNF inhibitor to eliminate that TNF. So, why do I want to talk about these medications today? Well, most of you by now probably know I had a very severe reaction to one of these medications. It took 19 months before doctors were able to identify that everything I was experiencing was a result of my medication. I was on Humira. There are a number of TNF inhibitors on the market. Most of them are used for people who are suffering from IBD. Many are used for people suffering from arthritis or maybe psoriasis, other conditions. But we all need them, or at least I thought I did. And once I went through my reaction, I started digging a little bit more so that I could learn about biologics, specifically anti-TNF inhibitors. And I was quite shocked with what I learned. I'll start by saying when I first began Humira, I was desperate, and I don't believe I'm very different from anybody else who's going through a very difficult flare, who is sick and unable to get their disease under control. I, at one point, was unable to really leave my house, and I've gone through that a couple of times in my life now. I had lost my ability to do all the things that I loved, so I was pretty desperate. When I came to the doctor, I really just wanted a solution, anything, so that I could get my life back. Looking back on it, I wish I had done things differently. I do wish I had done more research. But at the time, the doctor said, hey, you know what? I think this is going to be better for you. Take this shot once every single week, and it should get you into remission. He talked about side effects. The number one side effect that he spoke with me about was redness and pain at the injection site. That's what I heard most about. He also mentioned that I needed to take a tuberculosis test because this could make infections worse. And he also told me that I should keep an eye out for lymphoma, that there have been people who've developed lymphoma. Of course, and I readily admit this, at that point in time, if the doctor had told me drinking paint thinner would have helped my symptoms, I probably would have done it. I was desperate. So I just took what he said, all right, let's just start this Humira. And that's what I did. Now, after some time, I asked to come off the Humira for a few reasons. First, it wasn't really helping me that much. I was still having a lot of symptoms of Crohn's. I was still in a lot of pain. It was frustrating. I just didn't see this drug that they gave me as actually helping me. Another reason I wanted to come off is I could immediately tell that something was wrong with my body. I was feeling things I had not felt before. I was having some difficulties with just everyday life. I got sick all the time. If anybody had a cold or a flu within a 1 mile radius of me, I was going to catch it. And what's worse is it was going to escalate from cold to pneumonia to I have to go to the hospital very quickly. And it was frustrating. This is not the life that I particularly wanted. So I asked the doctor, hey, can I just come off this Humira? I don't want to take it. I was told very plainly, you need your medicine. You need to keep taking it. It's not as bad as people say. It doesn't really make you that sick. Well, tell that to my lingering pneumonia. And you know what? Now that I've had time to do the research, tell that to the thousands of people who died from infection, taking Humira. And that's what's been so surprising to me. I wrote a blog article this week on my blog, www.livingchronic911.com. And I called it, I have 99 side effects and injection site pain ain't one. Because as I continued on the medication, of course, I had all the side effects. It was astounding. And when I look back at it, I had continued to go see doctors. Now, at first, it was a little difficult to get in to see a doctor. I was told quite plainly, don't leave the house unless you're dying, because we had just entered the pandemic. We just started lockdowns. That's when my symptoms started really getting bad. So I followed directions well. I wanted to do the right thing. So I stayed home. But things got worse. And now that I look back at it, I look at the Humira website, humira.com. You can clearly read what some of those side effects are. And they were exactly what I was experiencing. Chest pain, numbness in my arms, shortness of breath. I had muscle weakness. I had muscle myalgia. And then, of course, later, towards the end, I had rash on my face, sensitivity to heat and sun, and various other symptoms that were nowhere to be found. But at least those were definitely on this website. I fault myself for not doing a better job. But again, as I said, I was pretty desperate. I probably would have drank paint thinner if I thought it would have made me better. But what about the symptoms I didn't see on there? Those were the ones I was really wondering about. You see, my muscle myalgia was so bad, I couldn't walk. My joint pain, the swelling, it was not anything that could be described the way it was on the site. I had severe mental health issues. Severe. I had mood swings. I was so depressed. And I had suicidal thoughts. And I did spend a lot of time considering whether or not I should kill myself. It was a very dangerous and desperate time for me. And fortunately, once I came off the Humira, I immediately started to see some improvement in my mental health. Of course, that was a long road. And while I had a lot of immediate relief, mental health, relief from my muscles, relief from some of the neurologic issues, here I am 1 year out from my last dose of Humira, a little over a year actually, and I'm still rehabbing. I'm still battling. I am still trying to get my body to even look something close to what it did prior to the Humira, because it looks like as of right now, I have a lot of permanent damage. And that was not on the Humira website, and it was certainly never covered by my doctor. So that's when I started trying to do some research on my own. First, social media is a very helpful tool. Now, it's not a scientific tool. I certainly did not do any kind of a study, and it's very possible that all of us who have experienced these types of reactions, severe reactions, to our medication. We probably all do go to social media to try to find each other. But I also found a lot of these reactions listed on the FDA's adverse reaction database. And you can go to that database yourself. You can search by your symptom. You can search by the medication that you're on. You can search by year. But you can go on there. The link is on my website. Again, that is www.livingchronic911.com. And at the bottom are resources, and you can click on that link to go find the FDA's adverse reaction database. I looked up Humira. There were so many reactions on there that included some of the ones that were on the Humira website and others that I had experienced, and then even more that I had never experienced. I stopped counting at over 200 reactions listed in that database. The reactions included severe mental health issues, suicide. It included death from infections, various other issues created by this particular medication. It was heartbreaking, really, to read through all of those reactions that had never been explained to me at all. And then I started looking at the drug classification as a whole. What are these TNF inhibitors doing? And that's when I found so much more. One of the first things I found, and up front, I was being tested for multiple sclerosis. It was inconclusive. When I first tested, I had just come off the Humira. We were doing these tests to see how much permanent damage, if any, I might have. And it was inconclusive as to whether or not I had multiple sclerosis. So I really was looking into that. And I found so many people just like me who had these kinds of reactions and now have multiple sclerosis as a result of taking their Humira. Again, this is not anything that was well explained to me. I can admit I had a responsibility to learn more about the drug, but at the same time, it's very predatory. When chronically ill patients go in to see a doctor, it's not just me. So many of us are desperate. We'll do anything to get better. So we're not thinking right. And you've got a doctor and a drug company standing there saying, I can make it better. So I would be willing to bet that there's a lot of patients out there just like me who don't do all the research because you're just desperate and you just want to get better. And the doctor, the person you trust, has said, take this. I was pretty amazed at some of the things I found. My doctor looked me straight in the eye and told me, no, it's not that bad. It's not as bad as you think. The infections, the illness, it's over-exaggerated how badly that can get while taking a TNF inhibitor. Well, there are numerous people who have died as a result of infections. I found the story of one woman in Florida who is a registered nurse and had a surgery, I think 2 months prior to starting Humira. And within a couple of weeks of taking her first shot, she was in the hospital with sepsis. So it's not over-exaggerated. And it needs to be emphasized more, just how sick you can become taking these medications. A friend of mine who I hope to have on the show soon, she is on a TNF inhibitor. She's on Cimzia and had issues with blood in her urine. The urologist could not find anything wrong with her. And she just has never known why she has it. I sent her the FDA adverse reaction website. She found that as a reaction to her medication. So there's a lot that we aren't told up front, and there's a lot to learn about. Some of the more disturbing things that I found out about TNF inhibitors. There's a study published in the medical journal JAMA Neurology. Forgive me if I'm pronouncing that incorrectly. And researchers from Mayo Clinic found that individuals taking medications that are a part of the TNF inhibitors class have a 3-fold risk of developing central nervous system events, including multiple sclerosis. Now, I can assure you, when I first started taking Humira, my doctor did not discuss that with me at all, nor did I find that on the website, nor did I see it on that little piece of paper he handed me. I heard all about lymphoma. I heard nothing about multiple sclerosis. Now, I don't want to live with any diseases. If somebody could please take my Crohn's, by all means. But I definitely did not want multiple sclerosis. And I don't think the other patients who've developed that did either. Suicide. Let's talk suicide. There are days I'm still honestly surprised that I did not take my own life. I felt pretty desperate in those days. Fortunately, I do have a good life despite how difficult it is. I've got great dogs and I have a really supportive and loving husband. And that is honestly what stopped me. Each time I sat on my bed with my pistol in my hand, I thought of my husband having to live the rest of his life with the trauma of discovering my dead, lifeless body, and it stopped me. And I feel very lucky for that. Other people are not so lucky. There are a number of suicides in patients taking TNF inhibitors. So many, and the information is so sporadic, it's difficult to find all the numbers. I will continue researching this, and hopefully I can have a better picture for a later episode. But there are drugs that have been on the market with a high risk of suicide. One of them being Siliq, S-I-L-I-Q. There are other drugs on the market for psoriasis. Siliq treats psoriasis. But Siliq has a very high risk of suicide, and the FDA approved it anyways. So some of the questions I'm going to be looking at over the next year as I'm doing this podcast is, why are the FDA approving drugs with such a high risk of suicide when there are other drugs on the market that have been proven to effectively treat the exact same disease, minus the risk of suicide? That's a big risk. That's a really big risk. And again, I think if some of these side effects were talked about up front, many of us would make different decisions about what we were going to do. Now, I know that many of us have probably lost a little bit of faith in the FDA. Whether you've had problems with medications, whether you watched the Michael Keaton movie, well, I think it was a series on the FDA and how they handled the opioid crisis. Unfortunately, I'm feeling very similar about biologics, particularly TNF inhibitors. I read the market for biologic drugs in the United States in 2018 was $125 billion, which was an increase of 50% since 2014. Since then, it has increased almost double and is projected to be over $300 billion by 2030. That's a lot of money. Some of you may be following the biosimilars in the United States. The cost of these drugs is just astounding. And for people who need them, who feel comfortable taking them, it's expensive. I once had the harebrained idea to leave Humana Military, which, by the way, is brilliant. And I realize that now. But I saw this shiny penny over here that said Johns Hopkins Military Family Plan. And I thought, well, that sounds better. It has Johns Hopkins in the name. But what I didn't realize was that it's a private company and they like to make money. So when they found that my medications were as expensive as they were, they just denied them and tried to send me all the way back to the beginning with steroids. And I will talk about prednisone on another episode because I think we all know how much we hate prednisone. But that's where they wanted me to go. And when I said, you know what, I will, until we can get this fixed, I'll go get my medications on my own. Except at the pharmacy I went to, when I went to pick up my 1 month supply, it was 10 grand. So it's kind of hard for me to believe that this is not at least partway money driven, because that's a lot of money. What's also interesting, taking into account how much money these bring in, are also how little the actual adverse effects are reported or actually reported to consumers by the FDA. The FDA has issued some black box warnings on multiple TNF inhibitors. They have aftermarket come back and required that they advertise certain side effects. I don't think it's been extensive enough. And what's very concerning is, even though I found within that database over 200 instances of these different side effects, and many of them being side effects that I myself have experienced. In 2005, a Government Accountability Office report estimated that that system only captures less than 10% of all actual reactions. You see, the drug company must report the reaction to the FDA. The patient and the doctor are not required to report. I find this just astounding. I did report my reaction both to the drug company and to the FDA. I believe my doctor had an obligation. I think we all have an obligation because we need to help the next person coming up. But with that in mind, how much do we not know about? How much do we not understand? And that's something I want to be looking more at, because these drugs are being prescribed each and every day. Right after everything happened, when we were still looking into my permanent damage assessment, if you will, which unfortunately a year later, we're still doing that. But at that time, we really were concerned I might have multiple sclerosis. And I called a few attorneys who had advertisements on the internet asking if you'd had a reaction to Humira that caused multiple sclerosis. And each one of them said the same thing. Well, they're not actually going forward with a lawsuit yet, because as of right now, the drug companies are standing behind the FDA and being protected. It's a move I like to call the Sackler. So here we are. There's information out there. There's a lot more information out there today than when I first started on Humira, and hopefully we'll continue to get more information. But in the meantime, what are we supposed to do as chronically ill patients who are desperate? So, what do I wish I knew when I first was diagnosed? So, here I wish I knew that I need to bring somebody to the doctor with me. For me, it's my husband. He's always been very supportive, but it's very helpful to have somebody you trust sitting there in the doctor's office with you to back you up, one, on what you're feeling and what you're going through, what your symptoms are, and two, to help you to think clearly. Because one thing is certain, when it comes to my health, after everything I've been through, I'm not thinking clearly half the time. If they throw any drug at me, sure, I'll take it. If one little thing goes wrong, I'm probably going to melt down. One day I'll tell the story of me having a complete meltdown in the middle of Walter Reed as Vice President Mike Pence was going in for his colonoscopy. But that's my mental and emotional state so many times, because it's difficult. I just can't be objective. So I bring my husband, and that's one of my first recommendations. Bring a loved one, bring somebody you trust to help you, to be your partner in advocacy. The second thing I wish I knew, and I now know and have learned the hard way, I do not accept any prescriptions while in office. I ask for a list of potential prescriptions, and then I go back home and thoroughly research to the best of my ability what the side effects of those medications are. It's difficult because you're not going to get everything you want to or need to know on the website, but you can find more on the FDA's website. There are medical journal article studies you can pull up. It does take a long time to read. I will admit that. I studied political science and business. I did not study science. So yes, it takes me a long time to get through these articles. It's very difficult, but it's worth it because I've learned a lot just from reading medical journal articles about what I went through and what can happen when taking certain medications. What else do I wish I knew? Anytime you're feeling something wrong, and we know when something's wrong, don't back down. I backed down. When I first knew that the Humira was not making me feel well, I tried to push back. And when the doctor, the expert, pushed back at me and said, no, you're not as sick as you think you are. It's not really causing those infections. You're not really having multiple upper respiratory tract infections every year. You're not really having the flu escalate to pneumonia each and every time. I somehow just thought maybe it's all in my head. All those hospital visits, everything I've been through must be in my head, but it wasn't. Clearly it was not. And I wish I had pushed back. And I think with bringing that advocate partner, you do stand a better chance of being able to stand up to that doctor. I know sometimes I feel bad. I don't want to look like I don't trust somebody, or, I went to University of Google Medical School. I hate when people say that. I'm not coming up with harebrained conspiracy theories. I'm bringing up very logical and real problems with the medication that I'm on. I'm telling you very real things that I feel. It's not in my head. I'm not making it up. So push back. Women especially, and people of color, are far more likely to be told it's in your head. It's not. And believe me, bring that advocacy partner, because that makes all the difference in the world. So hopefully today you've learned at least a little bit about biologics, TNF inhibitors. And if you're on one or thinking about starting one, please start with that FDA adverse reactions website. Read that in addition to the reaction sheet for the drug. Look up some journal articles. It's not an easy read, but believe me, you will be thankful that you did it, because it does help to have better understanding before you start taking what could be a very dangerous drug, and what could, in many cases, cause something as catastrophic as death. So again, if you would like more information, go to my website, www.livingchronic911.com. And thank you for listening. I'm Brandy Shantz, and this was Living Chronic.